Next.
Hello, I'm Amber Dooley.
Hi, Amber. I'm Miss Bible.
Nice to meet you.
Please have a seat.
Thank you.
So, Amber, I got your resume and your application in the mail, and I was impressed by what I saw, so I need to ask you a few questions if that's okay with you.
Okay.
So, what made you choose to become a nurse?
I want to help people feel better.
Okay. So, how has your training prepared you for that?
I took a 2-year allied health class in high school, and then I got my associates in nursing from a junior college, and I went back and got my bachelor's several years later at university, and that's about it.
Okay, so how do you handle stress on the job?
I take a cool down period in between patients, unless it's really severe and they need me just like that.
How would you handle a family who is displeased with your patient's care?
I would try to tell the family that we're doing the best we can for their loved one, and that we're working with all our might to save that person, save or cure that person.
Okay, how do you handle a patient who constantly complains about pain?
Well, I would ask, where's the pain at? What's the pain scale? We range it from 1 to 10, of course. 1 being the least, 10 being the best. I mean, the most pain.
Okay,
And then I would report it if it's really bad.
okay. Would you have sympathy for that patient?
I'd say to a certain extent I would, unless it got too much out of hand and he was doing it to get attention and nothing was really wrong. I still feel sympathy for him, but not as strongly as I would.
So how would you handle a doctor that's rude to you?
Be calm, sweet, and precise.
Okay. Amber, where do you see yourself in 5 years?
I see myself working in a high-level hospital as a trauma nurse, preferably working in the emergency room, helping numerous people.
What is your biggest strengths and weaknesses, would you say?
My biggest strengths, I'd say, would be I'm a people person because I get along with people better than most people do. Like, I communicate well.
Okay. If you had an older patient that had been in bed for 2 weeks and is short of breath and has a respiratory rate of 40, what would you do in that case?
Check the vitals again, just to make sure that I have everything correct, that the respiratory rate and everything was. I make sure I got all the BP, vital signs, all that. And if it was really bad, like I would, if it was really bad, I would call my immediate supervisor and ask him or her what to do. And if she thinks we need to call the doctor, then we call the doctor.
Okay, what if you're short-staffed and you can't get in touch with anyone and you have to perform a treatment that you've not done before? What would you do in that circumstance?
I'd work to the best of my ability to help the patient.
Okay. What type of nursing experience do you already have?
In college, I did most of my clinicals in the emergency room, helping like car crash patients, heart attack, cerebrovascular accident, or stroke patients.
So I saw on your resume that you would like to become an ER nurse. Is that why? Because you've done that before, or what reasons do you have?
Well, becoming an ER nurse, it's more the reason for that is more personal than just working. I mean, many years ago, I was a patient admitted into the ER with a traumatic brain injury. And it's like I want to give back to those nurses and doctors that helped me. And if they were to come in with major illnesses, I want to be right there to help them.
Okay. Would you rather work directly with the people or just on the information side?
I'd rather work directly with people because, like I said, I'm a people person.
So how do you keep current on all the medical findings and practices?
I do research and I watch the news and they have new practices and stuff. And I do research on all the new machinery and equipment used, like the CAT scans, MRIs, how they enhance them.
So how did you hear about our hospital?
I did research on top hospitals, and your hospital was on the top of the list. But also, it is the same hospital that I was taken to, so I know it's a good hospital.
So tell me why I should hire you.
Because I'm a loyal worker, a hard worker. I work well with others. I work well under stress, and I'm just overall a happy person to be around patients.
So what would you say your salary requirements would be?
Whatever you would say they would be. I mean, whatever they would be said as, I'm happy with whatever it is.
So if I decide to pay you $3 an hour, you're happy with that?
As long as I'm getting paid, it's fine.
Okay, Amber. Well, it was nice talking to you, and I will get back to you as soon as we make a decision on who we're going to hire.
Thank you.
Thank you.